welcome to a new video. Today we are going to discuss about the classification of mandibular fractures. So moving on to the classification of mandibular fractures, the first one, Kruger's general classification. So in this classification we have simple or closed fracture, compound or open fracture, comminuted fracture, complicated or complex fracture, impacted fracture, pathological fracture and green stick fracture. So what do you mean by the simple or closed fracture? This is the fracture which does not have communication with the exterior or the external surface. That is, this fracture does not produce any wound. Okay, this fracture does not produce any. So please excuse me for my bad handwriting. Okay, there will not be any wound. Okay, so this is a simple fracture. Compound fracture, this is the opposite of closed fracture. This is the fracture which has communication with the external environment through the skin. So there will be wound communicating, making this fracture communicating with the external environment. Okay, next one is the comminuted fracture. Okay, here in this picture we can see a compound fracture having an external communication with the environment. Next one is a comminuted fracture. Comminuted fracture is a fracture in which the bone is crushed or splintered into multiple pieces. Okay, for example, like in gunshots where the missile travels in a high velocity, this can produce comminuted fractures. Look, this is an example of comminuted fractures. Okay. Next one is complicated or complex fracture. Okay. Okay, complex fracture. These are the fractures which is associated with the damage to important vital organs. So if any vital organ get damaged, this is complicated fracture. Okay. Next one is impacted fracture. This is rarely seen in the mandibular fractures in which only one fragment is firmly driven into the other fragment. That is, clinically they are not appreciable. Next one is the pathological fractures. Pathological fractures are the spontaneous fractures of the mandible occurring from mild injury or due to mild muscular contractions, etc. This is due to the weakened or because of any bone pathologies. Next one is green stick fracture. Green stick fractures are mostly seen in younger children because of the inherent resilience of the growing bone. These are fractures in which one cortex of the bone will be bent whereas other will be seen as intact. So in this we can see the green stick. One portion of the bone will be bent, other portion will be seen intact. Seen in young children. I hope you all get an idea about the Kruger's general classification of fracture. Moving on to the next classification based upon the anatomical location. So based on the anatomical location, there are two types of classification. Rowe and Kelly's classification and Dickman and Native's classification. In Rowe and Kelly's classification, it is divided into first one, fractures not involving the basal bone. This is known as the dentoalveolar fracture, whereas the fracture involving the basal bone, it is divided into single, double, bilateral and multiple. Among the single and double we have unilateral and bilateral, then multiple. Okay. Next one based upon the anatomical location is the Dingman and Native classification. So from this picture you can get an idea. This is purely based upon the anatomical locations of the mandible. Just see here. When fracture occurs in the symphysis region, it is symphysis fracture. When fracture occurs in the canine region, it is canine fracture. When fracture of the body of the mandible occurs, this is fracture of body of mandible. When it occurs in the ankle, ankle fracture. When it occurs in the ramus, it is known as the ramus fracture. When it occurs in the coronoid process, it is coronoid fracture. When it occurs in the condylar region, This is known as the condylar fracture. When it occurs in the area where teeth present, it is known as the dentoalveolar fracture. I hope you are clear. Next classification is the relation of fracture to the site of injury. So this can be direct fracture, indirect fracture, and due to excessive muscular contraction during trauma. So direct fractures, these are where the site of injury occurs, fracture occurs there. That is the direct fracture. Indirect fractures are if the injury occurs on the left side and the fracture occurs on the right side. It is known as the indirect fracture, also known as the counter hook fracture. And next, due to the excessive muscular activity which leads to trauma, during trauma which leads to fracture. Next, based on the completeness of the fracture, it can be complete and incomplete fracture. Next, depending on the mechanism of action, how the fracture occurs, it can be divided into avulsion fracture, bending fracture, burst fracture, countercoup fracture, and torsional fracture. Okay, avulsion fracture occurs when a ligament or a tendon pulls heavy from a bone, which leads to the breaking of bone into small pieces. Okay, that is a ligament or a tendon is pulled away from the bone, thereby leading to breaking of a small piece of bone. Due to this, fracture occurs known as the avulsion fracture. Bending fracture is also known as a green stick fracture, occurring in the inherent resilient bone when when the cortex of one side is fractured where other part retains. This is known as bending fracture. And the burst fracture, in this the bone is crushed into small pieces. Countercoup fracture, as I have mentioned, when the injury occurs on one side and the fracture occurs on the other side due to transmission of force to the other side. Next, torsional fracture is due to the rotational spinal movement of the bone. Next one, based upon the number of fragments, we can single, multiple, and comminuted. Next one, involvement of integument. So based upon the involvement of the integument, we can divide it into closed or open fracture, and second one based on the grades of severity 1 to 5. So in grades of severity 1 to 5, 1 and 2 are closed fractures, and 3 and 4 are open fractures, and 5 are open fracture with bony defect. 1 and 2 are closed fractures, 3 and 4 are open fractures, and 5 is an open fracture with a bony defect. Okay. Next, moving on to the classification based upon the shape of fracture: transverse, oblique, butterfly, oblique surface. So this is based upon the shape of fracture. If the fracture looks in transverse shape, oblique direction, butterfly shape, sometimes the fracture occurs and the piece will have a similar look that of a butterfly because it will be of wedge shape. So based upon the shape, it's divided into transverse, oblique, butterfly, and oblique surface. And next one, direction of the fracture and the favorability of treatments divided into horizontal favorable fracture, horizontal unfavorable fracture, vertical favorable fracture, and vertical unfavorable fracture. So when we look the fracture or the side of fracture from the horizontal view, okay, we can divide it, classify it into favorable and unfavorable. So let's consider this picture. In this one is the favorable line of fracture, where this is an unfavorable line of fracture, because we look here the fracture is like this. So this muscle pulls the jaw upward direction, where there will be no displacement of the site of fracture, whereas in this, because this anterior portion doesn't allow the forces to be transmitted to the fracture site, but in this the line of fracture is like this, and when the muscles moves upward, the force will be directly transmitted to the fracture site and displacement will occur. And when we look the fracture site in the vertical, that is from the occlusal aspect, we can divide it into vertical favorable and vertical unfavorable. This one is the favorable, this one is the unfavorable. So let's take a look. Here the fracture travels from outside to inside in an upward direction. As a result, when the muscles acts, this element of fracture will not get displaced, or the force doesn't get transmitted because of this portion. Okay, this will act as a barrier, and in this case the line of fracture is from the outward to inward, is from the downward direction. So as a result, when the muscles act, there will be displacement of the fracture, or the force will get transmitted. I hope you all got an idea about the classification of mandibular fractures. Thank you.